Today we're going to take a look at heart anatomy. Here's the outline of this lecture. We're going to start off with the blood circulation through the heart. We will compare the right and left heart. We'll look at the conduction system. We'll look at some anatomy, and we'll finish off with looking at the coronary arteries. Let's look at the circulation of blood through the heart. Now remember, this is a loop system, so it doesn't matter where we start. Doesn't matter if we start in the superior vena cava or if we start in the left atrium. We'll come back through in the same order. So let's look at Rudy, the red blood cell. He's going to be oxygen poor, coming back to the heart, either through the superior vena cava or inferior vena cava. He'll drop into the right atrium, pass through the tricuspid valve into the right ventricle. He'd then pass through the pulmonic valve into the pulmonary arteries. In the pulmonary arterial system, he's going to flow out to the alveolar capillary beds, drop off the CO2 and pick up some oxygen, and return through the pulmonary veins to the left atrium. He would then pass through the bicuspid or mitral valve into the left ventricle. Then he would pass through the aortic valve into the systemic aorta. Once Rudy would be in the systemic aorta, he's going to flow out through smaller and smaller arteries out into the capillary beds. Out in the capillary beds, you have to remember he's going to drop off the oxygen and pick up CO2. Then he will return to the heart, flowing in small vessels to larger vessels and larger vessels until he would be back in the superior vena cava or inferior vena cava. Now you might ask, well, how long does this take? Well, at rest, this whole process would take anywhere from 35 to 45 seconds. However, during exercise, Rudy would do this about every 10 seconds. And here's a diagram of the heart with the flow of blood. And once again, the blood would come in through the superior or inferior vena cava into the right atrium, pass through the tricuspid valve into the right ventricle, out through the pulmonic valve into the pulmonary arteries. You'd return via the pulmonary veins to the left atrium, pass through the mitral or bicuspid valve into the left ventricle, out through the aortic valve into the systemic aorta. Let's look at the short axis comparison of the ventricles. On this slide, you have three different pieces of information. If you notice on the left, we have the diagram. The blue image there up on the upper right, that's an actual cadaver heart that has been sliced. And then at the bottom right, the black and white images, those are nuclear medicine images. Now if you notice the numbers 4, 8, 12, and 15 on all three of these images, they are all the same slice. Now looking at the cadaver heart in the upper right there, if you notice the thick-walled donut shape in image 12, that is going to be the left ventricle. Whereas that thinner wall that kind of wraps around the left ventricle, that is the wall of the right ventricle. Now, if you remember right, the arterial system, systemic arterial system, is going to be high pressure, whereas pulmonary system is lower pressure. And right here you can see mechanically why. You have that big, thick, strong muscle that will contract on all sides for the left ventricle, whereas for the right ventricle you only have a portion of that muscular wall that's going to contract to pump blood into the pulmonary system. Now if you look at the nuclear medicine study down below, you see that bright donut in each of those images. That is the left ventricle. Now that we've looked at the plumbing portion of the heart, let's take a look at the electrical system. Now if you see there on the left portion, the sinoatrial node or the SA node, that is the pacemaker of the heart. This is where you want the rhythm to come from for the heart. Now something to remember is that in the vascular system, the blood can only flow one direction, and it's going to be flowing from high pressure to low pressure. Whereas in the electrical system, it doesn't matter where the stimulation comes from, it will carry that electrical signal throughout that whole conduit. And so if you think of, you've heard of PVCs or premature ventricular contractions, all that's happening at that point is it might be down in the left bundle branch. There's a cell that gets excited and decides, I am going to pace right now, and so if the electrical signal will go on down the left bundle branch, but it's also going to travel up through the bundle of His and be carried into up to the SA node. So let's look at a normal rhythm. What's going to happen is the SA node is going to depolarize, and that charge is going to be carried right down through Bachmann's bundle, and this is what's going to, and then also through the anterior, the middle, and posterior internodal tracts. Now that is the stimulation that is going to give you atrial contraction. Now the internodal tracts is going to carry that electrical charge to the atrioventricular node, or the AV node. Now that works kind of like a capacitor there. There's a slight stall out of time right there, and then that charge will be carried down through the bundle of His, and then at the bifurcation there be carried through the left bundle branch and the right bundle branch, and end up, I don't have it on this diagram, out in the Purkinje fibers. And this is what is going to stimulate ventricular contraction. Let's look at some additional basic anatomy of the heart. This is an anterior view of a heart, and so you're seeing it anatomically correct. If you look to the left side of the image, it says there that you have the tricuspid valve. This is a valve that separates the right atrium from the right ventricle. Tri is 3, and cuspid would be cusps, so it's a 3-cusp valve. On the right side of the image, you see bicuspid valve, which is also known as the mitral valve. This valve is going to be between the left atrium and the left ventricle. Bi, 2, cuspid, 2 cusps. If you then look down there, you see the interventricular septum. The interventricular septum is going to be the wall that separates the right ventricle from the left ventricle. And up there on the upper left, you see the interatrial septum. It's not actually imaged or in this diagram. However, it is a wall that separates the right atrium from the left atrium. Now in both of the ventricles, you see the papillary muscles there. The papillary muscles are attached to the chordae tendineae, or heartstrings, and then those are attached to the cusps in both the bicuspid and tricuspid valve. The purpose of these two structures is to hold that valve from prolapsing during the high pressure of systole. Without the chordae tendineae or papillary muscles, the valve would simply flop open into the atria, and this would allow for blood to regurgitate into the atria. And finally, going from the left ventricle into the aorta, you have the aortic valve. Here's a diagram of the aortic root. You can see there at the bottom of the image you have the aortic valve, which that would mean that where you have the label of aortic valve, that would be in the left ventricle. Now you might ask, well, what is the aortic root? Well, it is a portion of the aorta that is still buried in the heart. Uh, I would take and compare it to what is the root of a tree. It's the part that's underground. Well, the aortic root is still in the heart itself. Once it breaks through the surface of the superior portion of the heart there, then it becomes the ascending aorta. Now I've got a good question for you. What are the first two arteries to branch off of the aorta? Well, a lot of people would fall for this one real quick, and that would be the brachiocephalic trunk and the left common carotid artery. Incorrect. The first two branches to come off of the aorta are going to be the right coronary artery and the left coronary artery. And here's a diagram of those coronary arteries. If you look there, you see the L, that's for left coronary artery. That C is going to be for, that's the conus branch. The left coronary artery, it starts off with what we call the left main. It will bifurcate into the anterior interventricular artery, or it is sometimes actually more commonly referred to as the left anterior descending artery, or the LAD. And then the other branch, main branch that comes off of the left main, is going to be the left circumflex artery. Left circumflex is going to wrap right around the heart and gives off to the branch of the marginal artery down there. Now looking back at the LAD, or the anterior descending artery, you have the diagonal, and you can have several diagonals come off, and they'll be numbered. The first one that would come off of the LAD would be diag 1, and the second one diag 2, and so on. And then you see the AS there. Those would be anterior septal arteries, and those actually go right into the intraventricular septum. Now looking at the other vessel there, the R, that would be right coronary artery. First branch coming off is the conus branch there again. And then you have the sinus nodal branch that feeds the sinus node. You can see the right coronary goes right on down to bifurcation of the marginal, and then you have the posterior descending artery. And then off of the posterior descending, you can see you have the PS, which is going to be posterior septals. And then your PLA up there is going to be posterior lateral artery. This is just a real basic diagram of an overview of the coronary system. Here's another diagram of the right coronary artery. You notice it says that it originates in the right coronary sinus. Well, think back to the image that we had of the aortic root. That space right above the aortic valve, that area there, is called the sinuses of Valsalva. And you have three sinuses there. This one originates from the right coronary sinus of Valsalva. This image does look different than the other right coronary artery, but that's because it's just a diagram from a different angle. You'll notice when you do your rotations through the cath lab that the cardiologist will take several different images at different angles in order to be able to visualize all the anatomy. And here's another diagram of the left coronary artery. And you notice it originates in the posterior coronary sinus. One thing about this, it is different than your other image, but here again it's a different angle. And something I wanted you to notice on this is I was talking about the diagonal branches, how they'll be labeled diag 1, diag 2, and so on. Well, here on the right side of the image you can see the way that that's labeled.